Today we're going to do a little anatomy and vocabulary, starting with this, which is a CT scan of my jaw and upper airway as of like 3 years ago. This is indicating that I have an intramolar width of 31 millimeters. Does that mean anything to you? No, and it didn't mean anything to me either. But if you're an adult with a normal size head, yours is probably 38 to 40 millimeters. And the fact that mine was 31 at the time really explained a lot of what was going on with me. When your upper airway and jaw are that small and crowded, lower molars start to tip inward to compensate, and your tongue has nowhere to go, and so you can't breathe properly when you're sleeping. So that was the problem that needed to be solved. Unfortunately for me, when you're an adult and need to add that many millimeters, there are very few options for you. When a child needs airway expansion, use this method, which is called MARPE, which stands for Micro Implant Assisted Rapid Palatal Expansion. Now, if you've had a kid that has had orthodontia lately, you'll recognize this. What it is they take an expander, this thing, and they bolt it in up through the roof of your mouth into the bone with screws, and then they give you a key, and you turn the key, and then the palatal suture pops open and it expands the airway, and then your bones remodel around that new space. That works in little kids and in adults that don't need a ton of expansion. Unfortunately, I needed 8 to 10 millimeters of expansion, which doesn't work in an adult because the palatal suture is fused shut when you're an adult. So the options were SARPE, which is surgically assisted rapid palatal expansion. And that's when a surgeon goes in and uses an ultrasonic saw to saw open the palatal suture so your airway will expand. Or what I had, which is called DOME, which stands for distraction osteogenic maxillary expansion. I hope I got that right. Which is when they not only saw open the suture, but also 2 horizontal bones in your upper jaw to allow the expansion to really take place. And because of my age and the amount of expansion I needed, DOME was really my best option. So after some time to get my head around all this, I made an appointment to have both the DOME surgery and the expander implanted into the roof of my mouth in December of 2022.